It is belonging, empowerment, and the ability to thrive. We are talking about the mission behind Golden Steps ABA Indiana. And here to tell us more is Senior Clinical Director Natalie Doughman. Thank you so much for being here.
Yes, I'm happy to be here.
I mean, this really is the biggest core of what you all do. It's changing lives. It's making a difference. Tell us how that happens.
Well, I suppose maybe I'll start with what we first do.
Sure.
We start with an assessment. We come to your home if we're doing in-home therapy, or you come to a clinic. We have 3 in the area of the central and northern parts of the state.
Okay.
And we meet you, we interview with you, we play with your children, and just try to find what might work best for you in your home. In these, we use this type of assessment to determine how many hours of therapy that we might need to be doing for your children as well. And if you want, I can kind of go a little bit more into that too.
Sure, because you mentioned this really is with individuals and families on the autism spectrum. So let's talk about how parents can know maybe which option is best for their child, and then the benefits of each setting as well. Because I would imagine parents who recently discovered their child is perhaps on the autism spectrum, this is new, it can perhaps be confusing and they're just not sure where to begin.
Yes, so again, we have 3 different types of settings that we can offer as an option. So we have our clinics, we have our in-home, and sometimes in school if it allows, as well as community options too.
Okay.
And really depending on the child's needs and the family's needs that is identified in that assessment, we can find what's going to be most beneficial for them.
So this is not a one-size-fits-all.
It's definitely not a one-size-fits-all. It's very individualized for each child's needs.
Which I would imagine that's a big part of why parents love how you do what you do, is because you're assessing the individual child, not just, okay, this worked for them, this will work for you, because even though perhaps they have autism or the same type of autism, every child is different. Is that what you see quite a bit?
Oh yeah, very, very individualized. Every child's different. Every family has different needs too, which is why sometimes in-home therapy could be more preferred. And that's one of the biggest benefits of our company, is that we do provide that. We come to your home, there's better generalization of skills across family members in the home, even siblings, which is a great benefit.
Oh, that's good.
Yes. In addition, of course, we work with your schedule. So there might be these clinically necessary hours that we are suggesting for your child, but we also want to work with what you have available. And that's a huge thing, especially for a busy family.
I love that. She's working around the parents' schedules, which is always really nice. Let's talk about how you incorporate play into therapy sessions as well to better engage the children. I mean, you know, play is really learning, just in a fun way.
Yeah, that is a really great question. Part of ABA therapy is incorporating what we call pairing. And pairing is the art of building rapport with the children that we meet, because in no way can we just walk into a home and just start making your children do work or things that they don't like to do. We have to do things that are fun for them. And so with pairing, we're doing things that they find enjoyable, playing with toys that they like, activities they prefer, and really just following their lead. And then with this, we can start building in some work activities and some learning activities, and we call that natural environment teaching, or NET.
Oh, I love this. As a parent, I appreciate what you all are doing so much. So thank you so much for being here. We'll put all the details about how you can learn more on our website, lifestylelive.tv.